Hello everyone. We start this channel activity with a comprehensive guide about flu vaccines since we are in the vaccination time. Influenza is a respiratory illness caused by viruses that occurs in annual epidemics, mainly in the winter. It may cause morbidity and mortality in susceptible patients. One way to prevent or decrease the severity of this illness is the vaccination. Who should get vaccinated? Annual influenza vaccination is recommended for everyone over the age of 6 months. Vaccination is most important for persons that are more vulnerable to complications, including individuals 65 years of age and older, pregnant women, home health care workers, blacks, Hispanics, or Latinos, people with health conditions such as chronic kidney, liver, heart, and lung diseases, diabetes, metabolic disorders, severe obesity, and certain neurological and neurodevelopmental conditions, including certain disorders of the brain, spinal cord, peripheral nerves, and muscles. When to get vaccinated? Vaccination is given once a year, and no more than one dose of seasonal influenza vaccine should be given to adults in a season. Vaccination should be given as soon as it is available, before the onset of influenza activity in the community, usually late October in the Northern Hemisphere and April in the Southern Hemisphere. It is better for most non-pregnant adults not to be vaccinated in July or August unless there is concern that vaccination later in the season may not be possible. Is vaccination effective? Vaccination is associated with a reduction in the incidence of influenza. In vaccinated individuals infected with outbreaks of influenza, vaccination leads to reduced mortality and less severe illness. Type of vaccines. Flu vaccines can be inactivated, recombinant, or live attenuated. Inactivated flu vaccines are based on egg or cell cultures. Cell culture-based vaccines are approved for individuals with 6 months of age and older. There are 3 types of egg-based vaccines: needle-free standard dose, adjuvant standard dose, and high dose. The first one is FDA approved for adults 18 through 64 years of age. The other 2 are FDA approved for people 65 years of age and older. Recombinant influenza vaccines are not approved for children and adolescents under 18 years of age. Today, the concentration of egg protein in flu vaccines has been lowered, and to date no cases of anaphylaxis have been reported with these newer vaccines. Therefore, people with egg allergies can receive egg vaccines without any concern. Inactivated and recombinant vaccines are injected in a volume of 0.5 ml into the deltoid muscle. To date, only one live attenuated influenza vaccine is approved for healthy, non-pregnant individuals aged 2 to 49 years. For healthy, non-pregnant adults aged 49 years and younger, any inactivated, recombinant, or live vaccine may be given. Live attenuated vaccine is a suitable choice for persons suffering needle phobia as it is administered as single dose from nasal route. However, this vaccine should not be administered to pregnant women, cochlear implant users, patients with chronic pulmonary, cardiovascular, or metabolic disease, individual with cerebrospinal fluid leak, immunocompromised persons, and caregivers of severely immunocompromised individuals. Vaccination with live attenuated vaccines while using these antiviral medications during the notified time windows causes vaccination to be less effective, and revaccination with other types of vaccines becomes necessary. Oseltamivir or zanamivir between 48 hours before and 14 days after vaccine. Peramivir between 5 days before and 14 days after vaccine. Baloxavir between 17 days before and 14 days after vaccine. Vaccination of older people. For those aged 50 to 64 years, any inactivated or recombinant vaccine may be given. Those aged 65 years and older can receive recombinant or inactivated high-dose or adjuvant vaccines. If these vaccines are not available, standard inactivated vaccines are acceptable alternatives. Vaccination and some illnesses. For people with mild respiratory illness unrelated to COVID-19, inactivated or recombinant vaccines may be given. For patients with COVID-19, inactivated or recombinant vaccines should be delayed until symptoms of COVID-19 have resolved, and isolation has ended. Vaccines should be used with caution in individuals with a history of Guillain-Barré syndrome within 6 weeks of influenza vaccination or with moderate or severe acute illness with or without fever. If you have had a serious allergic reaction in the form of anaphylaxis to a vaccine or any of its constituents, you should avoid that. Don't receive live attenuated vaccines if you suffer from upper respiratory tract infections. Rhinitis, cough, and sore throat may indicate upper respiratory tract infections. Adverse effects. Flu vaccines do not cause any serious side effects. Most adverse reactions occur locally at the injection site. The most common non-local side effects include fatigue, headache, loss of appetite, and muscle or joint pain. Most of these side effects are unlikely to occur in people who receive live attenuated vaccines intranasally. Thank you for your attention. In the next video we will talk about children flu shot. Here are the references.